Hey everyone, this is Tylah here, getting ready to show you our contradicted exercise of deadlifts. Alright, but before we get started, I'm going to tell you some of the muscles that are involved with our deadlifts. So to start out, we got the rhomboids, then we got the levator scapulae, upper and lower trapezius, the rectus abdominis, the erector spinae, just to name a few. Then to keep going, we've got our hammies, and then our quadriceps. Oh, can't forget about the soleus right here on the calf, And then best but not least, our gluteus maximus. So, those are just some of the muscles involved. So let's head to Dee to see what she has to tell us next.
There are many advantages and disadvantages when it comes to performing deadlifts. The advantages are multiple major muscle groups are able to work together at one time. Deadlifts are the ultimate lower back exercise if done correctly to decrease back pain. It is also one of the most effective exercises to strengthen hamstring and back muscles. They increase core strength and add core stability, which result in better posture. They increase a real-life lift, meaning that performing deadlifts develop muscles that you need to use while actually doing daily activities such as carrying something. It is considered safe if performed correctly. It is not always necessary to have a spotter while deadlifting, and someone does not have to worry about being pinned under a weight. Deadlifts improve grip strength. They increase testosterone and growth hormones with a significant amount of weight. And lastly, they can also be considered cheap and easy if you do not have a gym membership. The disadvantages include having improper form can result into serious injuries and chronic pain. The spine can be placed under a great amount of stress. Disc herniation in the vertebrae can easily occur if you perform a deadlift with a rounded back. The vertebral nerves can also be impacted by the amount of stress on the spine. It is also easy to overtrain a deadlift. Having an unbalanced grip placement can result in a bicep tear. Having the wrong stance may result in overworking certain body parts or muscles. Lastly, remember to always work within your skill level to avoid any further injuries.
You got them big. I got my personal level for deadlifts.
Nice, man. That's great. How you feeling?
Oh, my back is killing me.
Oh, man. Your back's killing you?
Yeah.
How was your form?
I'll show you this video when we get in the class. Okay?
Nice.
Look at this dude. Wait till you see the. No.
Yeah, the video was a little rough. He needs some milk. The form was off a little bit. You need to check out Destyni's deadlift form.
All right, for sure. I got you.
Up. Easy.
After analyzing Jaivon's form, Dr. Nick suggests to check out Destyni's deadlift. Watching her, we'll analyze a proper and accurate deadlift form. Begin by standing with the middle of your foot underneath the barbell. Bend over and grab the bar with a shoulder-width grip. Bending both knees until the shins touch the bar and making sure that it doesn't roll forward. Lift your chest up and straighten your lower back. Taking in a deep breath while holding onto the weight, stand up all while maintaining a neutral spine so that the bar comes to the height of the mid-thighs. Hold the weight for a moment at the top with gently locked hips and knees. Then return the weight to the floor by moving the hips back first and bending the leg at the knee. It is imperative, as we see in Destyni's form, to keep a safely neutral spine all the way from the cervical vertebrae to the base of the lumbar spine.